Without talking about atypical presentations, which is what we see every day with our elderly patients. They don't present with the classic textbook description. I mean, a couple of things I will say is that the older textbooks were all written by men, because men describe central chest pain, crushing. Women have different type of pain. Most of the textbooks are written for the middle-aged rather than the elderly. So they describe lots of symptoms of headaches with polymyalgia, headaches with Janssen arthritis, often missed in the elderly. They present differently. So I'm just going to talk about what we see as a jobbing geriatrician, what I see every day. And the reality is that elderly have multi-system disease. And I always teach my medical students that if you're above 80, if you haven't picked up 7 diseases, then you've let the patient down. And you can easily see, a bit of cataract, bit of osteoarthritis, you can easily come to 7. And I think that multi-system pathology is very common in the elderly. It's not a single disease we look after. We as geriatricians, we look after the patient and not the disease. The patient has a few diseases, but we look after the patient.